Lung cancer is the leading cause of cancer between men and women and the second most common cancer in the United States, according to the American Cancer Society. Now, here to tell us more about St. Barnabas' lung cancer screening program, we welcome now the Director of Division of Pulmonary and Critical Medicine, Dr. Raghu Loganathan. And thank you so much for coming and sharing with us.
Thank you very much, Daren. Pleasure to be here.
Good to have you. As we talk about this now, Lung Cancer Awareness Month, and we hear about lung cancer not knowing really how severe it is, but when we talked about in the intro about how prevalent it is, much of this could be possibly preventable with screening.
Absolutely. Lung cancer is the #1 cancer killer among both men and women. At least 400 people die each day of lung cancer. Each day of lung cancer, and it's a staggering number. And November is the lung cancer screening month, and I think it's a perfect time to talk about what strategies we have to detect lung cancer early. Unfortunately, lung cancer is detected quite often at a late stage where we have limited treatment options. And we have now an ability to detect lung cancer at an early stage, and that's the whole idea of implementing a lung cancer screening program.
And so, as you said, the earlier, of course, it's caught, the better it actually is. But when it's caught later on, the survival rate the numbers are pretty bad.
The numbers are actually quite bad. So among 100 lung cancers that are diagnosed at this time, less than 20% are diagnosed at an early stage. An early stage probably offers the best chance for cure. Unfortunately, a number of cancers are detected at a later stage, and the treatment options are limited, and certainly finding them early is probably the best way to manage lung cancer.
So SBH does have a lung cancer screening program. Let's walk through a little bit about what people how people can participate and take advantage of this.
So we implemented the lung cancer screening program this year, and it's one of the few centers in the Bronx that offers a very structured multidisciplinary program which talks about the various strategies to screen cancer early on. Patients need to understand that this is a partnership that they have to build with the physicians, understand what their personalized risk for developing lung cancer is, and understand what are the consequences of performing CAT scans and getting the CAT scans done early. At SBH, we offer a personalized tool for the patient in terms of what their risk for developing lung cancer is based on the smoking history. And most importantly, people who are continuing to smoke, what we call active smokers, we have a personalized management of how to stop smoking, what are the strategies that you have. So we have a multidisciplinary program. We're proud to have implemented this, one of the few centers in the Bronx that does this. And patients should talk to their physicians about see if they're eligible to get screening or not.
So for people who are out there watching right now saying, listen, I want to know about some possible symptoms, signs, what can you tell people about what are possible symptoms that really need you to do to get checked out?
I think more than symptoms, I think it is whether you're smoking or not and how much you've smoked. You need to understand that when lung cancer is detected because of symptoms, it's quite often late. So we actually want to detect lung cancer at an early stage, even before the symptoms start. So if you've been smoking, and the measure for estimating how much you've smoked is what we call pack years. So if somebody has smoked 1 packet of cigarettes, that's 20 cigarettes a day, for a year, it's called 1 pack year. And if somebody has smoked at least about 30 pack years, or if they have been smoking within the past 15 years, they would be eligible for lung cancer screening. They should talk to the physicians, and what we do there is a shared decision with the patient. We talk about what their personalized risk is. We talk about whether it's the right option for that particular patient and what they should expect with the CAT scan. The CAT scan is actually a very simple test. It's done in less than 10 or 15 minutes, but it's important to understand what it means to get their lung cancer screening and also explore opportunities to stop smoking if they're continuing to smoke.
How receptive are people to take advantage of the opportunity to do this? Because, some people are very resistant, we have.
Well, I think it's awareness of what the options are. Until recently, we didn't have the evidence or the recommendations from various societies to start screening. A few years back, there was a multi-center trial that showed that, and this looked at least 50,000 patients, and they found that there was a 20% reduction in mortality due to lung cancer if we screen for lung cancer and detect it early. So I don't think there's an awareness of this. Quite often people wait for symptoms like a cough or shortness of breath or coughing up blood, but that often unfortunately is late. We really have to target people who have smoked within the past 15 years. If they quit smoking, they should congratulate themselves on quitting smoking. It's not easy, but they should talk about screening at that point in time. If they're active smokers, then they really need to talk about strategies to quit smoking and also see if they're eligible to get lung cancer screening or not.
Mm-hmm. So Saint Barnabas Hospital is the place that you can come for lung cancer screening. This is Lung Cancer Awareness Month. Dr. Raghu Loganathan is here with us and sharing with us a little bit about lung cancer awareness and what is the most important things that people should know?
If you're a smoker, there are multiple ways how the healthcare community can help you quit smoking. Second, if you're smoked for a period of duration, and if you want to know what your risk is, there are multiple tools on the website. Speak to your physician, give us a call. We will sit down and talk to you all. Coming to see us in the lung cancer screening program does not mean that you have to be enrolled. We can make the decision together, and maybe getting a CAT scan can save your life. The American Lung Association has put out a message this month, saved by a scan, and I think that's probably what can happen. So your life could be potentially saved by getting a CAT scan to screen for lung cancer.
Now, you guys are one of the first hospitals to actually have this program. What do you think it means for you in the Bronx and the city?
I think we're very happy and very proud to have built this program. It takes a lot of effort. It has to be done in a very systematic fashion. Like I said, the actual act of getting the CAT scan is 10 or 15 minutes, but there's so much more that goes with it. We want to make sure the CAT scans are done with the right protocol. We use low-dose radiation CAT scans to minimize the harm of getting any side effects for the patients. We have very good patient navigators who will help the patients and their families walk through the system, give reminders before the clinic visits, give them reminders before their CAT scan appointments. And most importantly, you're having a face-to-face discussion with a pulmonary physician who talks to you about your personalized risk for lung cancer, what it means to have an abnormal CAT scan. A number of patients who undergo screening will have abnormal results on a CAT scan, but it doesn't mean it's cancer. So you have somebody who will walk you through this process and hopefully decrease the mortality of lung cancer through the screening program.
So if people want more information, what exactly do they do?
They can go to the Saint Barnabas Health System website. They can call the clinic number to set up an appointment. It is 718-960-3730. I hope I got that right.
You got that right? You got that right.
I got that right. So I think it's, and they can talk to their primary physicians and have them refer to us, or they can have a direct appointment to see us. And anybody who's between the ages of 55 and 77, those at least are the eligibility criteria at this time, and who are smoked, they should really talk to their physicians about looking at lung cancer screening. It saves lives. It's I would say it's a new tool that we have in the past few years, and it also gives a perfect opportunity to talk about smoking cessation for people who are continuing to smoke.
Dr. Raghu Loganathan, thank you so much for coming and sharing with us. As we said, this is Lung Cancer Awareness Month, and if you want to become a part of the lung cancer screening program that Saint Barnabas Hospital has, please use the number to call. Once again, that number is 718-960-3730, and be sure to talk to Dr. Loganathan or anybody over there at Saint Barnabas Hospital. I'm sure they'll be able to point you in the right direction. Thank you so much for coming and sharing with us.
Thank you very much. I appreciate it.
Good to have you, Dr. Raghu Loganathan. Listen, stay with us. We're coming right back with more Open. Be right back in a few.